1 out of 6 people are suffering from CKD. That was done in the India across the major cities. Kidney disease are silent killers. Most of the times what happens, patients present to us in the late stage. तो अब हमारे पास भी डायलिसिस वगैरह के अलावा ऑप्शन नहीं रहता.
So welcome. Today we have a guest, Dr. Shah, who's a nephrologist. He have a experience of managing the patient who have a long-term illness or long-term problems with their CKD patients. So we'll ask him how he is managing long-term patients, what it will take to build the trust during the long-term patients. Okay. So welcome to the Medical Marvel podcast, sir.
Thank you.
So doctor, you are managing patients from so many years. Your patient, once he will come, you have to stay 2, 3 years, 5 years sometime with you. So to build a trust, what you do so patient can stay with you, they don't choose again another doctors each time.
This is definitely one of the very important aspect of our practice, because as we know, our CKD patient has a long way to go.
Right.
Whenever we treat any CKD patients, we usually treat them for years together, be it in the conservative stage or be it in the dialysis or be it transplant. So basically, to build a trust, we have to create a rapport with them. Apart from the medical things that he or she is supposed to know, patient, we have to build trust, rapport with them. We have to counsel them properly, not just why we are giving this medication, why we are doing certain kinds of tests, what lifestyle changes they are supposed to do. I always emphasize very much on the diet and lifestyle. And along with that, how good their social setup or emotional setup or financial setups. Accordingly, we give them options.
So what is the importance of setting expectations? Because patient have sometimes different expectations, and the result will take time and different expectations. So how important to set expectations, clear expectations when patient will arrive to you?
This is very key aspect, specifically when we are dealing with the CKD patients. Because what happens in CKD, we can't cure it. We have to care for them.
You have to manage.
We have to manage. It will progress for sure. But what we are doing is we are decreasing the progression speed. So that has to be, clearly conveyed to the patient. Along with that, जब भी पेशेंट हमसे आते हैं, नेफ्रोलॉजिस्ट सुन के ही वो लोग डर जाते हैं किडनी, क्योंकि मिथ्स इतनी सारी है. तो वी हैव टू क्लियर देयर मिथ्स आल्सो, बिकॉज व्हाट आई टेल माय पेशेंट, विथ किडनी डिसीज जिंदगी रुकेगी नहीं, जिंदगी जीने का तरीका बदलेगा.
अमेजिंग लाइन. जिंदगी रुकेगी नहीं, जिंदगी जीने का तरीका
बदलेगा. क्यों? क्योंकि वी हैव अ टेक्नोलॉजी अवेलेबल. हमारा फर्स्ट पोर्शन ये रहता है कि वी डिक्रीज द प्रोग्रेशन. उसके लिए मेडिसिन, लाइफस्टाइल, डाइट, ये सब बताते हैं. उसके बाद व्हेन ही और शी रीचेस इन द एडवांस सीकेडी स्टेज, दैट इज रीनल फेलियर स्टेज 5 जिसको हम बोलते हैं, तब डायलिसिस, किडनी ट्रांसप्लांट वगैरह की जरूरत पड़ती है. बट वी हैव अ गुड टेक्नोलॉजी इन टुडेज डेट, एज वेल एज गुड गवर्नमेंट स्कीम्स, एज वेल एज इंश्योरेंस स्कीम्स आर ऑल्सो अवेलेबल, कि जिसमें हम अच्छा डायलिसिस प्रोवाइड करते हैं. पीपल डू लिव फॉर डिकेड्स. ट्रांसप्लांट भी पॉसिबल है, किडनी ट्रांसप्लांट भी हम रूटीनली करते हैं. तो पेशेंट की गुड क्वालिटी ऑफ लाइफ इज देयर. एंड एट टाइम्स वी गिव एग्जांपल्स ऑफ आवर रियल लाइफ पेशेंट्स, एग्जांपल्स ऑफ सेलिब्रिटी हु आर सफरिंग.
So what do you think that you are dealing with a long-term patient, and medical college will teach you the clinical aspect, okay?
Yes.
There is no systems or there is no syllabus to to motivate or how to stay long periods, patient who is long term. So how do you build relationships?
That is
or a doctor is for what skill doctor is not prepared to deal with long term patients who have to deal a long term outcome.
Basically, communication is the key. Setting goals, setting standards, setting standard of care with clear cut plan is the key. Communication part is something that is slightly lacking in our medical curriculum, that we would like to upgrade a bit. वो हम यूजुअली बाहर आके पेशेंट से कंटिन्यूअस डीलिंग करके विथ एक्सपीरियंस एंड इंडिया वी हैव अ वाइड स्पेक्ट्रम ऑफ पेशेंट्स, समवन हु इज कमिंग फ्रॉम द विलेज as well as someone who is having a who is a factory owner or something like that. So we have to cater to all. So depending upon their expectation, depending upon their reality, we have to treat accordingly, plan accordingly for their long term management. That is the important thing that one
So
should.
my next is I have seen that CKD patients comes too late to nephrologist when the situation is already worst. So what need to change so patients can come to right doctor at right time?
It is the most important question and most important thing that not only doctors but also laymen should understand. Whenever we are having a risk factor for kidney disease, diabetes, hypertension, aging population, cardiovascular, urological issues, whenever you have a risk factor, always take two things, that is creatinine. With the help of creatinine, we can calculate the estimated GFR. We can have a number how much our kidney is functioning. And second basic test is urinary albumin excretion rate, spot urinary albumin to creatinine ratio. With this test, we can see how much amount of protein is being excreted in the kidney. These two are basic tests that has to be carried out in the population.
My thing is, what is the right time or what is the general practitioner who is doing when he should understand that it's not my case, I have to refer to a nephrologist? What is the fundamental he have to observe and
Whenever-
he must transfer immediately, so it won't be a late.
Yes, definitely. Whenever there is rising creatinine, eGFR is decreasing below 60, there is significant albuminuria, one should refer for a specialized consultation because kidney disease are silent killers. And for the kidney disease, we say that knowing is half battle won. डायग्नोसिस हो जाता है, आप अच्छे से प्रिवेंटिव एस्पेक्ट्स पे फोकस करो, प्रॉपर ट्रीटमेंट एस्पेक्ट्स पे फोकस करो, यू कैन सेव इयर्स ऑफ लाइफ टू पेशेंट व्हेन ही इज डायग्नोस्ड इन द अर्ली पार्ट. मोस्ट ऑफ द टाइम्स व्हाट हैपेंस, पेशेंट्स प्रेजेंट टू अस इन द लेट स्टेज, क्रिएटिनिन बहुत बढ़ गया, सांस फूल रहा है, 5 से क्रिएटिनिन हो गया, तो अब हमारे पास भी डायलिसिस वगैरह के अलावा ऑप्शन नहीं रहता है. बट आगे पहले ही प्रेजेंट कर गया 1.5-2 क्रिएटिनिन पे ही, eGFR 60 के आसपास है या प्रोटीनूरिया हुआ, तो we can add many more meaningful years to the patient's life.
What the biggest mistakes doctor who is dealing the CKD or a long term patients or mistakes they are doing right now? So it's not in a clinically, non-clinically, what mistakes they are doing?
First thing that I would like to address is late referrals, as we have already addressed. Then other thing I would like to tell is कि people are very much scared of the kidney disease. उसमें जनरल प्रैक्टिशनर का रोल भी ये आता है कि आप काउंसिल कर सकते हो कि भाई किडनी डिसीज से फुल स्टॉप नहीं आने वाला है. वन कैन हैव अ गुड लाइफ विद द किडनी डिसीज, गुड क्वालिटी ऑफ लाइफ if properly managed. And other thing that needs to be corrected, specifically in the Indian scenario, people are using painkillers left, right, center.
Right.
They are taking OTC medicines. मतलब कुछ हुआ, दर्द हो रहा है तो मैं सर दुकान पे जाके ले आया, मेडिकल के भी जाके ले आया और भी कौन सी दवाई दी पता नहीं है. वो चीजें नहीं होनी चाहिए आज के जमाने में. One should always avoid nephrotoxic drugs whenever they are having a risk factor, and along with that, good blood pressure and good diabetes control has to be carried out at the grassroots level. जनरल प्रैक्टिशनर्स, एमडी, फिजिशियंस, उन सब का रोल बहुत ज्यादा आता है. अगर बीपी डायबिटीज वगैरह कंट्रोल में रहे, नेफ्रोटॉक्सिक ड्रग अवॉइड रहे, तो जो आजकल हम देख रहे हैं सीकेडी पॉपुलेशन, सीकेडी प्रिवेलेंस बहुत ज्यादा बढ़ रहा है. एक स्टडी हुई थी इंडिया की, सिक इंडिया स्टडी, जिसमें देयर वाज alarming results. 1 out of 6 people are suffering from CKD. That was done in the India across the major cities.
So, my last questions will be, doctor who is coming right now in the practice, whether MBBS or whether MD or a nephro, whatever, what they need to do 2 or 3 tasks so they can have a futures better OPD or a patient, according to your view, or what are you doing? I don't know. So we would love to understand what works for a doctor or what works for nephrologist.
empathy is the number one thing that I
To
would
build the patients. I know if
for
patient
patient,
is,
empathy for
how
patient.
you bring the patient to your OPD.
Basically, in the current situation, it is a word of mouth and your work will say a lot.
Okay.
इनिशियली कोई भी आपका फ्रेंड होगा या वो होगा तो रेफर आपको नेफ्रोलॉजी में जनरली रेफर्स आते हैं कि
Refers.
क्रिएटिनिन तकलीफ है तो आप जाके नेफ्रोलॉजिस्ट को दिखाओ. अभी अवेयरनेस बढ़ रही है तो पेशेंट खुद से आ रहे हैं बट मोस्ट ऑफ द टाइम इट इज योर कलीग सर्जन फिजिशियन ENT guy who is sending you.
How to set up a better referring network so directly they don't think directly they'll refer to you. What kind of relations you must build with the referring doctor so directly whenever they comes they directly refer you. They don't think second thought also.
Trust, honesty, and empathy to patient. These are all three my backbones.
So how do you build a trust so the referring doctor feel that okay he is the person I don't have to look.
See, clear-cut
What are the
advice.
activity
Clear-cut advice in the simple manner that patient can understand as well as the referring doctor can understand. It has to be honest and genuine. If it is treatable, just say. Not treatable, then say. Apart from that, I usually look after the finances also. Okay, if patient is coming from a
What kind of
simple
background,
class,
yeah.
poor class, then treat them in the trust hospital or government hospital. If they are having a good, they need services more, then it has to be
So
treated in the
if a
corporate.
doctor
So
have
overall-
referred to you one patient and after all the evaluate when you finish your day, so whoever referred, would you if you call to him, how this will make impact sir? आप एक patient ये refer किया था, ये मेरे पास आया, ये diagnose था.
नहीं, ये तो
This will build a trust.
definitely it's a very important thing to do because in our practice what happens, मैंने समझाया वो जाके जिसने भी भेजा है वो उनसे पूछने ही वाला है.
Right.
तो ऑलवेज वी ट्राई मतलब जब भी टाइम होता है तो इन बिटवीन द पेशेंट और एंड में या वैसे कि ये है इवेल्युएशन में ये आया है आगे ये वर्कअप चाहिए ओपीडी बेस चाहिए इंडोर चाहिए प्लान हम ब्रीफ में डिस्कस कर लेते हैं और वो बहुत इंपॉर्टेंट चीज है ट्रस्ट बिल्ट अप विद द रेफरिंग डॉक्टर एज वेल एज विद द
Patients.
पेशेंट इवेंचुअली व्हाट हैपेंस इज वर्ड ऑफ माउथ. आप अच्छा काम कर रहे हो खुद ही मतलब अभी पेशेंट भी
But it will take time. I was the initials. You have to do lot of activity in any business or any practice. You have to do initial lot of activities, right? So thank you for joining this podcast and sharing your knowledge and wisdom to doctor community. How to deal the patient who's have a long term therapy. Okay. So thank you and
It
thank
was
you.
nice.